Bismillahirrahmanirrahim. The lecture of today is about saliva and dental caries. Saliva is a unique, complex, and important body fluid that contains a number of systems important in the protection of oral mucosa and even the whole body from oral infection. The word saliva is synonymous with other words like spit, whole saliva, mixed saliva, and oral fluid. The word saliva refers to the pure secretions of the major and minor salivary glands in the oral cavity, while oral fluid refer to all types of secretions in the oral cavity involving secretions from the parotid, submandibular, and sublingual major salivary glands, hundreds of minor salivary glands, gingival exudates, food debris, desquamated epithelial cells, and microorganisms. General functions of saliva involve first physiological functions, thus lubrication, digestion, oral clearance, speech, etc. Second, maintenance of the health of the oral tissue through the specific and non-specific immune factors. In addition to other physiological function, buffer capacity, that's important in neutralizing the acidity in the oral cavity. Its saliva is considered to be a reservoir for different ions that's important in remineralization of teeth. There are different antimicrobial properties in the saliva, and finally, saliva play an important role to keep the water balance. Agglutinations considered to be route of excretion of substance that reabsorbed by gastrointestinal tracts, etc. The main constituent of saliva is water, forming about 99.4 to 99.5%. This is according to stimulation of saliva. Other constituents involving organic, like protein, carbohydrates, and lipids, and in addition to inorganic constituents with different electrolytes. The general factors affecting salivary constituents involving first, salivary flow rate. The concentration of organic and inorganic constituents of saliva, in addition to water, differs between stimulated and unstimulated saliva. In stimulated saliva, there is more water compared to unstimulated saliva. There are constituents of saliva, for example, bicarbonate. In unstimulated saliva, it is with low concentration, is about 1 millimole per liter, increase to even 60 millimole per liter in stimulated saliva. Electrolytes like calcium, sodium, and chloride was recorded to increase with stimulation of the saliva, while other minerals fall in its concentration in resting saliva, for example, magnesium, potassium, and phosphate. The other factor affecting salivary composition is the nature of stimulation. Salivary glands are innervated by parasympathetic and sympathetic fibers. In stimulation of parasympathetic, there is an increase in water and electrolytes level, while the sympathetic stimuli increase the mucus secretion. If we want to stimulate the secretion of saliva, we can use chemical or mechanical or psychological stimuli. Chemical stimuli, for example, using salt, and this may stimulate protein secretion. For chemical stimuli, we can use acid, and this leads to an increase in the alkalinity of saliva. Mechanical stimulation, like for example using chewing gum, may increase water composition. The weakest stimuli is psychological stimuli. The third factor affecting composition of saliva is the duration of stimulation. With the increasing of the time of stimulation, there is an increase in water, bicarbonate, and protein, but there is a reduction in chloride. Ages is considered to be other important factor affecting composition of saliva. With increased age, there is an increase in calcium and phosphate concentration. This may explain why the young children have less calculus formation compared to adults. There are other factors affect composition of saliva, like medication, diseases like diabetes, and exercises. The second important factor of saliva is the salivary flow rate, and about 1 to 1.5 liter of saliva is secreted per day. This is for healthy adults. About 0.5 to 1 ml of saliva is present in the oral cavity at any time. There is a variation in the salivary flow rate between stimulated and unstimulated saliva. For the lasting saliva, there is about 0.3 ml per minute in the oral cavity of saliva, while by stimulation, there is a secretion of 2 ml per minute or even more. There are several factors affecting salivary flow rate, as we can see in the other slide. There are different factors affecting the flow rate of saliva. The first one, nature of stimulation, and as I mentioned, there are 3 different types of stimuli involving mechanical, like chewing gum, chemical, like putting an acid, or psychological. The poorest type is the psychological stimuli. Second factor affecting the flow rate of saliva is the salivary gland size, and the size of salivary glands in male is larger than females, so there is more flow rate of saliva in males compared to females. Age is a factor affecting the flow rate of saliva, as the salivary flow rate in adults is more compared to children. Medication may affect the flow rate of saliva. There are certain drugs which reduce, causing reduction in the flow rate of saliva, like antidepressant drugs and analgesic drugs. The body posture is also affect the flow rate of saliva. Saliva is more in standing than sitting, and it is the least when the person is lying down. The time of the day also affects salivary flow rate, and this is called circadian rhythms. Saliva flow rate is in the peak in the afternoon. There are other factors which is called circadian rhythm. It means its effect according to season. In the winter, the saliva is secreted more compared to summer. Saliva and dental caries. Different types of studies recorded an increase in the incidence and severity of dental caries with the reduction in the flow of the saliva. The first type of studies involved animal studies. It has been shown that desalivated animals fed cariogenic diet lead to development of rampant caries, while clinical and observational human studies reported an increase in both incidence and severity of dental caries with the reduction of salivary flow rates. So hyposalivation may lead to an increase in dental caries. This is because any reduction in the salivary flow rate leads to a reduction in the quantity of saliva and minimizing the important physiological function of saliva, as we will discuss in the following slides. Hyposalivation, it means there is a reduction in the buffer capacity, and the buffer capacity of saliva is important in neutralizing of the acidity of saliva. The acidity is an important environment for growth of cariogenic bacteria. The hyposalivation may lead also to alteration in the amount and bacteriological composition in the dental plaque, favoring the growth of cariogenic bacteria and increasing the risk to dental caries. So when we say hyposalivation, it means there is a reduction in the quantity of saliva. Thus, there is a reduction in an important protective constituents in relation to dental caries. For example, there is a reduction in unimportant elements like calcium and phosphorus. Other trace elements like fluoride, zinc, strontium, all these elements are important for enhancing remineralization of the outer enamel surface. Reduction in the flow rate of saliva, it means there is a reduction in the bicarbonate, an important buffer in the oral cavity, especially in stimulated saliva. When there is a reduction in the buffer, there is a chance in increase of the number of cariogenic bacteria, thus increase in dental caries. Reduction in protective constituents, there is a reduction in specific and non-specific oral immune factors that is related to or this may cause increase in dental caries. A reduction in the quantity of saliva may affect the important physiological function of the saliva, that is oral clearance. Oral clearance is very important in relation to dental caries because by clearance we can remove a remnant of carbohydrate, acidity, in addition to removal of bacteria from oral cavity. So in any impairment in oral clearance, there is a chance in increase in severity of dental caries. The buffer system of saliva. Buffer is any solution that tends to maintain a constant pH. The normal pH of saliva is arranged between 6.7 to 7.4 with a very wide individual variation. pH is the negative logarithm of the hydrogen ion concentration. In intake of carbohydrate, this pH can drop to even below 5.5 and may reach even 2.1 or 1 in its value. Below 5.5, demineralization of the outer enamel surface started. By the action of the buffer, there will be neutralization of the acid and elevation of the pH value. Thus, instead of demineralization, there will be an enhancement of the remineralization of the outer enamel surface. The buffer system in the saliva involving bicarbonate, phosphate, proteins, and urea. The composition of the buffer system in stimulated saliva differs from that of unstimulated saliva, as we're going to discuss in the next slide. In stimulated saliva, there is an increase in the concentration of the bicarbonate, which is considered to be the main buffer in the saliva. When acid is formed, it will react with carbonate, forming a carbonic acid. This weak acid is decomposed rapidly to water and carbon dioxide. The carbon dioxide will escape the solution, thus there is an increase in the concentration of carbonic acid, causing more reaction between acid and bicarbonate, and by this there will be an elimination of acid from the oral cavity. In resting saliva, phosphate is the main buffer. When there is a decrease in the pH, in resting saliva, there will be dissolution of apatite crystal and releasing of phosphate. Phosphate attempts to restore the pH balance, increasing pH level, thus enhancing remineralization. Urea is also a buffer in the oral cavity, and urea is going to decompose to form ammonia, and the ammonia is the buffer. So urea is an indirect buffer in the oral cavity. Here is a question to you. Answer please and give explanation. Which one is much more important in relation to dental caries? The bicarbonate, the main buffer in stimulated saliva, or phosphate, the main buffer in resting saliva? Reduction in the flow of saliva, or what we call it hyposalivation, can be caused by infection, anxiety, fasting, pathological reason, medication, etc. In severe cases, it will lead to severe dry mouth, and this condition is called xerostomia. Xerostomia may lead to increased severity of dental caries. Any patient with sign and symptom of xerostomia is instructed the following. First, must keep good oral hygiene measures. Second, dietary restriction to avoid ketogenic diet. Avoid xerostomic drugs after consultation with a physician, in addition to fluoride therapy. The fluoride therapy for a patient with xerostomia involves self-applied fluoride, that is dentifrices and mouth rinses, or dentifrices or fluoride gel. While in the dental clinic, it's advised to apply either stannous fluoride or fluoride varnish to minimize the risk to be affected by dental caries. For those patients with xerostomia, they may feel some pain, so it is advised to give artificial saliva to them. Thank you for your kind listening.